From the plains to the rolling hills, Oklahoma is a state that resonates with stories of resilience, determination, and pride. Welcome to Inside the 1581, a podcast of the Oklahoma Hospital Association. Together, we'll dive deep into the heartbeat of the great state of Oklahoma as we journey through the rich history, diverse culture, and the ever-evolving landscape within the 1,581 miles of border in our nation's 20th largest state. Each episode of Inside the 1581 will feature conversations with the many voices which help shape our state's future and our shared vision of improving health and healthcare in Oklahoma.
Welcome to this special edition of Inside the 1581. You heard from one of our episodes. We had Trent Borland, who was here from Cole County Community Hospital, talked a little bit about what's going on in his community. And we're breaking up our Inside the 1581 into a couple segments that we're going to sprinkle here through the month of December. And as I mentioned in the previous episode, Connect Conference is the opportunity for healthcare leaders to come together, to network, learn from one another, hear from noted experts in the field, and to really give us an opportunity to collectively focus on the work of improving health and healthcare in our state. And I'm delighted to have joining with me today is Denise Webber, who's the CEO at Stillwater Medical Center. She is the board chair of the Oklahoma Hospital Association and has really grown up in hospitals in Oklahoma. And so Denise, we're glad you're here. I know it's a little bit loud, so we're trying to eat the microphone as we lean in, So for our listeners, Inside the 1581, we've really pushed it to a lot of different audiences, not just those of us that work in healthcare. And particularly our Medicare Disadvantage website, our numbers were off the chart on that. So a lot of seniors found it, and which is kind of the intended purpose. But today we're just asking healthcare leaders, about how do they feel about where healthcare is going in our state? And before we get to that question, can you tell listeners a little bit about Stillwater Medical Center?
Yeah, happy to, Rich. Happy to be here as well. So Stillwater Medical is a regional health system in north central Oklahoma. We have a PPS acute care hospital in Stillwater and then two rural emergency hospitals, one in Perry and one in Blackwell. And that we were one of the first in the nation to apply for that designation.
I think you were the first in the nation.
We had to be pretty up there.
Well, and I was going to say for our listeners, what Denise is talking about is that when we talk about rural PPS, that's kind of our lingo. It's how we're paid. So hospitals that will consider themselves PPS hospitals means they're based on a diagnosis. So, you receive a diagnosis as a patient, and we're paid based on that, regardless of how much it costs to deliver the services to you. So we could lose money on treating you, or we can make money on you or break even. For rural emergency hospitals, you don't spend the night there. You are a new innovation that the federal government has created, and that new innovation essentially pays the hospital to serve as a super emergency room when you almost think about it.
Well, and you can spend the night there.
Oh, you can? I didn't know that.
Yes.
I was not aware of that. Okay.
Now,
for Medicare, you can't.
No, you can't.
Really?
Just because
I'm learning something from my board chair.
There you go.
Okay, very good.
Because of the two midnight rule.
Yes, that's jargon for us again.
Yes,
so,
exactly.
Okay, you're right,
so,
you're
yes,
right.
We don't have...
Don't let us take the time to explain two midnight rule, because we'll be here for a day. Okay.
But you may end up staying the night in a rural emergency hospital.
Okay.
But not very long. It's a short stay. You're being observed, kind of watching conditions, trying to get them in the right place at the right time. So that's a little bit about Stillwater Medical. We have about 50 locations spread throughout north central Oklahoma, clinics, hospital departments. So
well, and I would think that you're spreading out really does bring the healthcare closer to where people are, and
that's our goal.
It's important.
Yes, it is. It's that's a barrier to people, especially in the more rural you get. There's a lot of, and I can't tell you how many people, Rich, I've heard that do not want to get on 4-lane highways. 2-lane.
One of them,
Yeah.
I mean, I love the little winding roads and no traffic.
Yes, and so we try to do our part to locate centrally based so our patients can get to their medical care. So you asked about the current state of healthcare in Oklahoma. I'm so glad to be here at OHA Connect, and it's been a great conference so far. Paul Keckley talked to us earlier, and I thought his analogy, he analyzed all the states.
He's pretty dry, but he's pretty blunt.
Yeah, he is.
Yes, he is. I've known Paul a long time.
I have as well. And I agreed with his message, but he talked about Oklahoma, and that when you look at where we're at as an industry, that we're in the fairway. So there's a lot going for us based on the dynamics of our state. And I would say I agree with that. I was just talking to one of our small rural hospital CEOs earlier, just checking in with him to see how he was doing, and he said, things have gotten better, and a lot of that's to a credit to the thanks of OHA and advocacy and trying to turn the financial struggle around. But I think Paul challenged us today. So while that landscape is pretty good right now for healthcare in Oklahoma, it's now time to dig in and make sure that we keep it that way versus falling back. So
well, and I think we have an opportunity to experiment and innovate. It's funny because I was just talking to Todd Schuster at St. Francis and with Paul. Imagine for a moment if in communities that may not be able to sustain their county health departments, if the hospitals by contract were able to deliver public health.
Right.
And we start to see that convergence, which we heard from some of our tribal members that is what they are doing. What could we learn from that?
I had the very same sentiment when I was listening to Paul and thinking about the convergence of healthcare and social dynamics. And, there's no reason when I think about all the various organizations in our community, in our area, that struggle from time to time. And is it now our time to step in and say, how do we bolster that fabric? Because I was talking to Tim Pearson last night. It's very evident the government is moving us towards risk, and if we're going to get in that risk dynamic, we can't ignore the social side of health. It's that's why they end up coming to see us.
Well, and if we can be part of managing that, part of the environment around that individual that would give them a better sense of optimism and a better understanding of resources, that it doesn't default back to the hospital, which we see it all the time, right? Because somebody doesn't have access to whatever the social service needs are, they default to the hospital and we figure it out.
Yeah, we say we medicalize social issues.
That's a very good point.
Yeah.
That's a very good point.
For
so
sure.
if we look at some of the things you've done in Stillwater, I know Judy and I had a great time at your gala. And it was great just to see people excited about a campaign to bolster what you're doing in your emergency department. I am sure there's a lot of examples of things that you as a leader and your team are really proud of at Stillwater. What would be a couple of examples that people would learn from the success of what you've been doing there?
So to me, any community or the communities we serve, it's about when we earn dollars and create future sustainability for our communities, that we listen to them and what they need. And so we do try to do our part to stay connected with our community. And one of the things that they've been asking us for a long time has been pulmonology. And so we have just started a new pulmonology program. And what is so exciting that I find fascinating is we're bringing AI. So the community in north central Oklahoma has really been without adequate pulmonology for years. So you think of the undiagnosed lung cancer that's in our area because we haven't had the providers. And so we are taking all of our images and interlacing them with AI to go back and try to find patients that we would have taken care of differently if we would have had access to pet care, and going to reach out and say, hey, come see us. And it is just, to me, fascinating how AI is going to change our ability versus having to have a human go back and look at every one of those images. They can be loaded in, and AI can do some, what I'll call magic, and then we know who to reach out to. So it's exciting.
Well, and we did, I'm looking at Alex, we did 2 episodes, didn't we, on AI? And so we talked about that. And I think for most folks to understand, we're not talking about the Terminator here or anything like that. But what we are talking about are highly sophisticated systems that allow us to scan and rescan and rescan an image, as one example, and looking for potential abnormalities that were missed from the naked eye or missed from our normal way of displaying that information, whether it's an image or data, and going back to that and then opening the opportunity to reinvestigate.
Right.
And that to me is exciting, particularly, and we're looking right here at the Fuji mobile mammography facility, looking at how AI just in the area of imaging has allowed us to find things that the computer sees much quicker than the human eye. And we have really talented radiologists, right?
Oh, yeah.
But this gives the radiologist something to hone in on really quick.
Well, and what's really interesting about the data so far is that we need both.
Right.
And so you look at radiologists without AI, and they're pretty accurate. I want to say it's like 93% accuracy. You look at AI, and it might be 91. You put the two together, and it's 97.
Right.
And so it is, and who wants to be that percentage, that 6%? You know what I mean? So I'm excited for the future and what AI can do, and especially we don't have enough. Radiology is one of the largest shortages of physicians currently, and so the timing couldn't be better for that kind of working together to try to extend our radiologists. The other thing that we are trying to get off the ground, which our community has rallied around, OnQ donated $1 million to bring this to happen in our region, is a NICU, level 2 NICU, which Stillwater has never had. And so that will come to completion in 2025, and we'll be able to take care of some of the littlest ones that have to be shipped, which is a huge part of infant mortality.
And where do most of them get shipped to? Are they coming to Oklahoma City? Are they going to Tulsa? Where do they go?
So a lot of them, what's ended up happening in our state is the higher level NICUs get full with babies that don't necessarily need our highest level of care in the state. And so our kiddos are having to go to Dallas, Kansas City. And so there's so many correlations to infant mortality. The farther the family, the farther the baby has to go.
Well, and you separate mom from her baby.
Yes.
And yes, we clearly know that how important it is for that connection to be there.
Yes.
Yeah.
So.
Well, that's exciting.
It is exciting. So.
Well, if we looked at the footprint that Stillwater has and your economic impact, do you believe that your community fully understands the impact that you have on jobs, on its how the dollar that you spend in your organization is respent across the community?
Probably not, and that's always a shame on us. We, and I'm going to blank on his name, you brought him in at the strategic plan. He came from OSU. He's a product of OSU.
Oh, yeah, yes.
Anyway, he's an economist.
Dr. Sneed.
Yes, thank you.
Yes.
He's come in several times. In fact, he was just recently in Stillwater, trying to educate our Chamber of Commerce. And so we do educate on that, but I don't know that we get to the people that aren't in the Chamber of Commerce,
Right.
just, every day people trying to sit down and understand why they can't pay their bills. Stillwater is interesting. So our largest employers in Stillwater are all public. We've got Oklahoma State University as the largest, Stillwater Medical, a public trust, is the second largest, Stillwater Public Schools is the third largest, and then you've got the city of Stillwater. And so when you think about healthcare and the healthcare ecosystem in our community, it is a huge economic driver when you think of our average income. And so, again, going back to Paul Keckley and his words earlier, we've got to do a better job of, one, everybody understanding. And I thought it was fascinating, the state's data. And of our top 10 employers, 6 are public and the next 2 are health systems. That's something that we're going to have to really grow to understand a bit more, because I don't even know that we industry leaders understood that. That's a different dynamic in Oklahoma than in other states.
Well, and we're a $30 billion organizations too. And I think the other important part is that the people who are on our teams are incredibly skilled, they're highly trained, and they're compensated because of that skill and that training. And every one of them is paying property tax, they're paying sales tax, they're buying homes for their families. So we really are a stabilizer.
We are the economy to some
degree. We are the
degree.
economy.
Yeah, and that's where I don't know that, when you survey people, are you happy with healthcare? I don't know that they understand when they're clicking yes, no, or in the middle, do they understand how much that creates the access and the quality of life that they have in a community because of the ecosystem of healthcare.
Well, absolutely. If you're a local merchant,
right,
truly understanding how much of your product is being purchased by
yes.
people who work in the hospitals or are tied to it.
Yeah.
You can make the same claim too if you're a realtor. Yes, and I think for us as a field, it's doing a much better job of telling that story.
Yes.
I think that's going to be important. As we look forward, and I know you've been sitting at the board table and you've been involved in the OHA for a number of years, and certainly when you work with your colleagues around the country, you're probably hearing lots of stories about challenges that we have going forward. If you did your own environmental assessment, what do you think would be the biggest challenge or a couple challenges here in our state and maybe nationally?
The biggest challenge that I see is workforce. I think healthcare is such a huge, as we talked about, dynamic in the economy. And we know, let's just put the workforce challenge on the side. We have known that we have needed to disrupt healthcare well before we had what I would call a true workforce shortage. And so my opinion of the biggest challenge is now that the rubber's meeting the road and there's a lot of pressure from a GDP on we've got to fix healthcare, we're doing it at a time when workforce challenges are immense.
It goes back to supply and demand again.
Exactly.
Yeah.
And so that will create a weight to change, a resistance to change, and it's just, I think that's going to be something that we're going to have to unpack around OHA because, how do you get creative and disruptive when every other, probably not every week, but definitely every month you're getting letters from your physicians or your whoever saying, I need X or I've got an offer over here.
Right.
That's hard to disrupt in the middle of that.
Well, and it is, and we also see so many physicians are being purchased by health plans,
yes,
and others, so that the supply we would naturally have, or those who are involved in private equity, that normal supply has been disrupted by new market entrants. Many of them don't play by the same rules.
Yeah.
So you have that, but I think it's also, and I'd be curious your thoughts on this, is that we often think of hospitals as nurses and physicians, but we have folks that work in the business office, we have folks that are doing IT, we have team members that are working in environmental services and in culinary, physical plant management. If you look at a hospital, we're mini cities.
Oh, it's completely.
And we have to sustain a mini city.
Completely. And the shortages are not just with our clinicians. In fact, we are climbing out of an AR issue because we couldn't find people for our revenue cycle. And so that's one of the things I talk to our team about on a regular basis is I think the disruption that we are going to have to do first. I was at a conference, probably a year and a half ago, and it stuck with me. It was hilarious, Rich. We're all complaining about nobody wants to work. We can't find the workers. And they showed us 100 years worth of headlines. And it went back, the headline 100 years old was, the women don't want to churn the butter.
Yes.
And so we've got to find a new balance to where people they want to work for us because we've designed the work to where it's better than it is today. And then maybe we can look at the whole larger picture. But I feel like workforce, we've got to figure out, just like we were working on 18 months ago, how are we going to stabilize the finances? I think workforce is the next big challenge.
Well, I think, and I know you've seen this data and you've heard conversations about, the generations that are coming online now and the generations have recently come online. They really are being motivated by purpose.
Yes.
And I think there's very few vocations or fields that you can work in that are more purpose-driven than healthcare.
Yeah.
So I think there's a message for us when we do market ourselves. So I'm going to close our conversation off with, tell us about your purpose. I mean, you got into this for a reason. Was it really to be the athletic trainer to your husband who hurt his back when he played basketball at OSU? Or was there something else? But I think all of us, we don't get into this to punch a clock. We get into this because we're called into this. So maybe you can share with folks that are listening, what is Denise Webber's purpose? How did you get into this?
So I've always had a passion for serving others. And at 14, I was a candy striper at Broken Arrow
We don't
Hospital.
have many candy stripers anymore. I think my wife was too,
yes.
I believe. Yeah.
That was what we called volunteers back in the day. Mm-hmm. I was a candy striper. And I will forever remember the difference that I felt like I was doing I had a big job of bringing the papers and the flowers to the patients, But
imagine that, papers.
papers,
Oh.
yes, the papers.
Yes,
Yeah,
yeah.
I'm old. I'm that old.
Yeah.
And the just the impact, you could tell that they were not their best. But the little bit of, and so to me, Rich, there's many dates in people's lives that they remember forever. And I think sometimes some of us, and I try my hardest to remind our team of this, that the dates that they're in our walls are dates they remember for the rest of their lives.
Right.
I can remember when my grandfather had a stroke on Thanksgiving, and instead of around the Thanksgiving table, we were around the Thanksgiving hospital bed. And the people that put him back together, I will forever be indebted to. And so we're a part of the dates people remember for their whole lives. That's why I do this. It is an amazing work.
Yeah.
To help be a part of people's lives.
Well, there's a great book called The Power of Moments. I don't know if you've ever read it. And so, and in the story, one of the ones that I enjoy the most, it was talking about the John Deere experience. And if you are an employee of John Deere, you're a dear friend. These experiences that we have in healthcare, there can be no more personal experience than in healthcare.
Right.
So, well, Denise, thanks for joining us. You've been listening to this episode of Inside the 1581. We're here at the Connect conference from OHA. And we've invited some healthcare leaders to come in and talk to us. Just a couple of quick prompted questions. And you were just hearing from a candy striper that has graduated into running one of our health systems here in Oklahoma at Stillwater Medical Center, Denise Webber, who also serves as the chair of the board of the Oklahoma Hospital Association. So when we come back, we'll probably come back to another episode, so you'll have to wait till Alex drops us again. But we're going to space these out here over the course of the next couple of weeks as we listen to some of the voices that are helping to lead our healthcare systems in the state of Oklahoma as we work together to improve health and healthcare in Oklahoma.